Hello. In hair transplantation, how is number of grafts calculated? How is the cost calculated? This is a paramount question asked by most patients. And to answer this, I am Dr. Venkataram Mysore, dermatologist, hair transplant surgeon, Venkat Center for Skin and Plastic Surgery, Bangalore. The number of grafts needed for a given area depends on several factors. Area of baldness, which is in turn depending on the stage of hair loss, stage 1 to stage 7. The density and the type of hair unit available in the donor scalp, whether it is how many are 1 hair units, how many 2 hairs, how many 3 hairs, how many 4 hairs. The source or the donor area, for example, beard hair is thicker, body hair is thinner. So body hair more would be needed. Then the thickness of hair. This is something not understood by patients. The thicker the hair, better the result for the same number of grafts. Thinner the hair, you need more grafts for the same type of result. This is another very important factor because hair is a cylinder. So volume of a cylinder is pi r square h. That means radius is squared. So small difference in radius makes a big difference in volume. Then the color of the hair and color of the skin. Black hair and black skin covers better. But black hair and a fair skin, the fair skin color shines. Then curliness of hair. If the hair is curly, it runs serpentine, so covers larger area. And finally, length of hair. Longer the length, the more area it covers. So if a patient is willing to grow longer hair, he will get a better result. In addition to this, there is one final factor. What is the attitude of the patient? Which style does he want? To give a simple example, if we comb the hairs in one direction, the hairs which start here all come this way, so maximum bulk is achieved here. If on the other hand, supposing we comb like this, all the hairs go backwards, the maximum bulk is achieved in the center where it is not needed. Then the other factor is which area are we operating. For example, vertex is a circular area, front is a triangular area. So vertex needs more grafts than the front. So please understand that this is a fairly intricate, complicated issue which needs some knowledge and expertise. It is not a simplistic calculation. Then there is one more thing that you all have to understand. What are we trying to achieve in hair transplantation? We are trying to achieve a cosmetic density. What is cosmetic density? Cosmetic density means a density which you perceive or appreciate at this distance, about a meter. That is how we meet people, social distancing. Nobody comes near and separates the hairs and see how much density is there. You look at a fraction of a second at a person and see, oh, he's got good hair. Oh, that doesn't have good hair. It takes a fraction of a second. That kind of appreciation needs what is called a cosmetic density. Cosmetic density is generally half of normal density. That means if the natural density in a bald person in this area was 80 per square centimeter, we give half of that, which is just 40 per square centimeter. Why is this so? Number one, it is enough. Number two, the donor area is small. We don't have so many hairs to give the same real density which you had. And number three, if you make 80 holes in 1 square centimeter, the skin will just tear. And finally, even if you were to manage somehow 80 hairs in 1 square centimeter, they will all compete for same number of, same oxygen, same nutrition, and yield will be less. So they have to be spaced apart. Generally, it is about 2 millimeters or sometimes 2.5 millimeters between two hairs. That is why the other factors that I mentioned, such as thickness, the curliness, color, length of hair, all these are important to give a good result. Finally, there is one additional factor, and that is the artistic temperament of the operating surgeon. That is where his skill, his imagination comes in figuring out where I should put which density, where I should put larger grafts, which way I should put, what is the direction. These are all depending on the skill of the operating hair transplant surgeon. So now, once this is understood, that this is an intricate calculation of different factors involved, so you will understand that it is never the same for two people. For the same amount of baldness, in some it may be 1200 units, some it may be 1500 units. Now, the next question is, I hope you have understood by now, what is a unit, what is a graft, what is a hair. This has been explained in previous videos. Just briefly I will mention. The hairs here, each hair is called a follicle. In dermatological terms, in technical terms, hair is a follicle, hair follicle. It contains one hair. Follicular unit is a group or a bunch of hairs or follicles. So one follicular unit can contain 1 or 2 or 3 or 4 hair follicles. So on an average in Indians, it is around 2.2 hair follicles per unit. So if I say somebody needs 2000 units, that means he needs 4000 hairs. Now let us look at the cost of transplantation, how it is calculated, what is the number of grafts needed for each stage, and also why sometimes different clinics may give different estimates. You need to understand what is a follicle, what is a follicular unit, what is a graft. These have been explained in earlier videos. Just to mention here briefly, follicle means a hair. It's a technical term for hair. We call it hair follicle, means one hair. Follicular unit is a group or a bunch of hairs, 1, 2, 3 or 4 hairs. In an Indian head, on an average, one unit is 2 to 2.2 hairs. So when I say 2000 units, I mean 4000 hairs. Graft just means a piece of tissue taken from one place to another place. It can be skin graft, hair graft, muscle graft, bone graft. In this case, it is a follicular unit graft. Cost can be calculated either per follicle or per unit as per the choice of the clinic, but the patient should know how is it being calculated. Is it per follicle or is it per unit? For example, if we say 50 rupees per unit, it will mean 25 rupees per hair. So it should be very clear. Then now let us look at what is the number of grafts needed for each stage. We will start with stage 2 because stage 1 we generally don't like to operate. We manage by medical means. On my right side, you will see images of different stages. Stage 2, a small area of recession here, maybe in the center also. This generally needs about 800, 900 to about 1200 units. This patient is also likely to be a young patient who may bald in future, so we need to preserve hair. Now the next image, stage 3, little more recession, some thinning in the center. This will need anywhere from around 1400 to 1800 units. Please note, I am giving a range. I am not giving one figure because as I described you in the earlier part of the video, there are several factors which affect the outcome. Patient's attitude differs. Sometimes patient's requirement differs. For example, an actor might need a higher density. So since these variables are there, what is given is a range, then precise estimate is given for each patient at the time of examination. So stage 3 is 1400 to 1800. There can be a 5 to 10% variation in these numbers. Stage 4, it is going further backwards in the front. Some amount of thinning is also happening in the vertex. This can lead anywhere from around 1800 to 2500 or even 2800 units, depending upon the various factors that we have already discussed earlier. Stage 5, we are reaching a large area of baldness. Vertex baldness is also getting larger. So this may mean anywhere from around 3000 to 3500 to 3800 units. One variable here, and that is the amount of vertex baldness. Vertex baldness being circular, as I explained to you earlier, needs a larger number of grafts. So that is stage 5. Stage 6 is a very large bald area. Here, what can be done depends upon what is available as a donor area. It may need a combination of hairs from beard, body and scalp. So roughly it may need anywhere from around 4000 to 4500 to around 5 to 5000 grafts. This depends upon again the quality of hair, the type of unit, thickness of hair, how many beard hairs, how many body hairs. That is a very variable figure. Stage 7, which is the last area of stage of baldness, very large area, needs a huge number of grafts. In fact, it is quite difficult to get that many grafts in most patients, from around 6500 to 7500 units. This can only be done in combination with beard and body hair. Even then, it is not possible to cover every area in the same way. Now, why do then different clinics give different numbers, as patients say? Recently, we had a patient, we told him 1500, somebody had told him 2500. Now, there can be 2-3 explanations for it. One, we mean units, they might have meant hairs. So, if I say 1500 units, somebody says 2500 hairs, it is roughly in the same range. But it cannot be 1500 units by us and 2500 units by somebody else. What the patient understands, what he has been told, that should be very clear. The second reason may be the attitudes of both the patient and the clinic. If one disregards what can happen in future, let us do whatever possible now, then you can put as much as you want and quote as many grafts as one wants. But we don't work that way. We look at a patient over a period of 10 to 15 years that we should be able to service his requirement over that long period of time. So we like to preserve for the future. So our estimate is always a little conservative. Our attitude is to give what is optimum for a patient, not what is maximum for a patient. If somebody wants more hairs in a particular area, in a particular profession, that can always be considered. But any estimate has to take into consideration what is needed now and also what may be needed later. The third reason may be just commercial. If we put more, the clinic gets more money. So why put less? Why be conservative? So this way, there can be reasons for such variations in estimates. But my suggestion to patients is, it is not very difficult for you to understand this. All you have to know is what is the surface area of baldness. Divide it by 2. And that roughly gives you the number of grafts needed. Supposing in the front it is 30 square centimeter, you need around 1500 grafts. That's all. Same thing goes for vertex, which is a circular area. So with a simple mathematics, one can know how much grafts are needed so that one will not be taken for a ride. So now my final summary. The estimate is an important aspect of hair transplantation. Understand the word follicle and follicular unit. Know how much is needed for the surface area. Always understand that what is done is optimum density, cosmetic density. What is cosmetic density? Cosmetic density is something which is appreciated at social distancing. and then always be clear as what is being told to you. I hope you will like this video. If you like it, you can please visit our website and read more about it. If you want to listen to any more topics, please communicate to us, venkatcenter.com, and we will be happy to produce more videos for you. Thank you very much. Have a nice day.